Good evening, everyone. We are waiting just a couple more seconds before we start, so we get a couple more people while we start rolling in. While everybody's rolling in, I just want to say good evening and welcome. My name is Jackie here from WEGOHEALTH, and thank you all for joining us tonight for our Patient Leader webinar. I think we're really going to enjoy tonight's topic because it's something that everybody can relate to, balancing your work life and your chronic life. So whether you're a business owner or an employee, working with a chronic illness can be really tough. It can get chaotic and it can get really messy. So we're happy to share that tonight we have a patient advocate and author, Ilana Jacqueline, who just recently wrote a book called Surviving and Thriving with an Invisible Chronic Illness, who is here to host and talk to us about how to streamline that workload, how to communicate effectively, and more importantly, how to handle some of those really awkward situations that can come along in your professional life when you're managing your symptoms and you're managing sort of your other life, your patient life. So with that, I'd like to turn it over to Ilana for the webinar.
Thank you so much. Can everyone hear me okay? I think so.
Yeah.
Awesome. All right. Thank you so much for joining me tonight, guys, for this WEGOHEALTH webinar. Tonight, we're going to be talking about how to manage your career with a very active chronic illness. And again, that is something we all can relate to, whether you work for a company in an office or you're someone who telecommutes, you're a consultant, you work part-time. So hopefully this webinar will help give you some very helpful tips and advice, and let's dive right in. So I'll tell you a little bit about who I am for those of you who do not know me. My name is Ilana Jacqueline. I am first and foremost a patient. This is my too tired to function sweatshirt, and that's somewhat of my motto sometimes. But I have been a patient for pretty much all my life. I have dysautonomia, primary immune deficiency disease, and gastroparesis, and kind of all of those things that go along with it. But I'm also a professional. I am a professional patient advocate. I'm an author. I've been a marketing consultant in the past. I've worked for Global Genes for 5 years. I worked for them as their managing editor, and now I work as manager of patient advocacy for FDNA. I also do consulting, and I do a book, but I'll tell you a little bit about that in a second. So some of you would know me best from Let's Feel Better, which is my blog where I've been sharing my personal story since 2012, since I was first diagnosed with dysautonomia. And my blog thankfully was popular in the patient community and ended up being turned into a book called Surviving and Thriving with an Invisible Chronic Illness. So I'm going to tell you a little bit more about that in a second. But if you want to connect with me, you can do so on social media all over the place. I'm on Twitter, and I'm on Instagram, Ilana_Jacqueline. So if you're on Instagram, connect with me, and yeah, let's be friends. Okay, so let me tell you a little bit about the book. I'm very excited. This is the launch week. I even got a million messages today about people who received their copies as far as the Netherlands, so that's crazy to me. Anyway, this is the cover of the book. The book is, it's basically the ultimate patient guide, and it's for dealing with social, emotional, financial, independence issues, all related to having an active chronic illness. And, you know, I wrote this book and I wanted people to know that this was coming from a place of, you know, a patient that is an actively chronically ill patient. I'm not someone who's been cured. I'm not someone who's, you know, overcome really the total end of a chronic illness. I'm really living with it, and I'm really working with it every day. So I want you to know that I'm in the same boat as you, and the work that I've done and the advice that I'm giving, it's partly my experiences, and it's also the experiences of so many patients and advocates and professionals that I interviewed during the course of researching this book. And I think, and I hope that we can really all learn from all of that collective knowledge. So the book is available for pre-order now all over. It's on Amazon, Barnes & Nobles, Target, Walmart, all that good stuff. But it'll be in bookstores everywhere on March 1st. So, and it'll be in the US, the UK, and in Canada. So who is this webinar for? Let's talk about that for a second. Anyone with a chronic illness, anyone who is currently employed, anyone who is unemployed, hoping to become employed, someone who is on disability and wondering if they can ever work again, anyone who owns a business, anyone who consults, as many of us do, or works part-time or from home. This webinar is also great for anyone who has maybe never been employed yet. Maybe you're a student or someone who is, just has kind of been living with a disability all their life and hasn't been able to break into the workforce and is not sure how their disease is going to fit in with being a professional. And you're wondering, maybe, does it completely preclude me from having a career? And it doesn't. So stay with me here. So let's talk about some of the obstacles to working a 9-to-5 with a chronic illness. And there are a lot, guys. And this is why so many people struggle with this. But we're going to talk about some of the different symptoms and some of just the realities. So let's start with a major one. This is just something that I hear from people all the time. I suffer from it myself. Chronic fatigue. Chronic fatigue is a huge obstacle when you are trying to have a career. Who has the energy? It's difficult to function in an office. It's difficult to function even if you're working from home when you have chronic fatigue. Chronic fatigue can lead to brain fog, and so many things lead to brain fog. Brain fog is really when you have trouble staying focused, when you lose your train of thought, which I'm sure will happen at some point in this webinar, but certainly happens to all of us with chronic illnesses. And it can make being a professional just awkward in a lot of situations if you can't stay on task. Inability to commute. So this is a little bit more literal one. So a lot of us can't drive anymore. Some of us need to work from home. Some of us can't take public transportation. So that's a big issue. Chronic pain. It's really hard to do your job when you're on the floor of your room in the fetal position, just in agony. That makes it really difficult to keep a job. So I would certainly say that's a large obstacle, and it's something that people suffer with frequently and intensely. Immune deficiencies. I myself have an immune deficiency disease, and this flu season was a killer. I just wanted to stay in my house the whole season. And for people who have to work in an office environment, they may feel like, how is this going to be okay? If I catch the flu, it's going to take me 3 to 4 times longer than everybody else in my office to recover. And I'm going to lose track of all of my work. So I think that one's a really big deal for people, and can certainly be just a complete halt when it comes to the idea of getting a job. Weakness. While a lot of us are focusing on jobs that are more cerebral, any jobs that require any kind of physical labor, even very small tasks, can be very difficult when you have weakness associated with chronic illness. Neurological episodes. I'm talking about things like epilepsy, like episodes of Tourette's. I have dysautonomia. I faint sometimes, and that is horribly awkward in an office environment when you're working with clients, when you're doing presentations. Super awkward. How are you supposed to deal with that? Sleep disorders. We talked a little bit about chronic fatigue, but what about narcolepsy? That one is difficult both in practicality of working. How are you going to deal with the symptoms of narcolepsy, things like cataplexy, and also the stigma of it, which, like many chronic illnesses, it's difficult to explain. It can be embarrassing, and it can be hard for people to understand. It can be misinterpreted as laziness, which is just a horrible feeling and a burden to carry while you're trying to do your job. IBS symptoms. Oh my goodness. When you're working in an office, nobody wants to be the one employee who is using the bathroom all the time. Just a bad situation to be in all around. Now, I work from home, and I also have IBS symptoms. And even working from home, this can be a real challenge because some days you're just in the bathroom all day. So I have some great tips on how to handle keeping up with your workload when that's happening. Frequent hospitalizations. So this was really hard for me personally. I owned my own business, and there was one year where I was hospitalized easily over 10 times, and I just completely dropped everything. I just didn't know how to handle it, and it took me a long time to figure out how to prepare for things like that. Frequent hospitalizations can just make you feel like that's it. Your life is over. Your career can't even begin. So that's something we'll talk about as well. Anxiety and depression can be their own sense of a chronic illness, but they also come with many chronic illnesses and can be a big distractor while you're trying to do your job. Migraines. Migraines are really hard to work through when you're trying to shut yourself in a room for 24 hours with pain medication and complete darkness. How are you supposed to work through that? So these are all major and probably very familiar obstacles and very real obstacles to working with a chronic illness. So the main problem here, I cannot predict in their entirety the severity or the onset of my symptoms. I mean, that's the main issue. I can't tell you when they're going to happen, and I can't tell you how bad they're going to be. And if I can't predict them, how can I expect my employers or my clients to understand when I suddenly become unavailable? And if my situation changes, as a result of my disease, as a result of having a bad flare, how is that going to impact the rest of my life? How is it going to impact my paycheck and my rent and the life that I've set up for myself? Basically, what I am asking is, how can my career become sustainable with a chronic illness? So these are some of the main problems. So let's talk about the solutions now that we've gone over all of that. Choosing the right job. Now, this is a big one. I talk about it a lot in the book. It's actually something I spend a good majority of a chapter on, the realities of choosing the kind of job that's right for you. Well, the first question you want to ask is, am I qualified to the job being asked of me with reasonable accommodations? I want to use the example of, let's say you're a Crohn's disease patient and you have completely unmanageable symptoms at this point. You're not in remission. You haven't been in remission for a long time. You're struggling, and you're an airline pilot, and you're spending 24/7 in the bathroom. That is not a job that is going to be a realistic job for you to continue doing. And I know that this can kind of be a soul-crushing discussion to have, but it needs to be had. There are a lot of people that I talk to that talk about certain jobs that they have that are overall, in the long term, not realistic to continue doing when your body is not going to agree with you. Fortunately, we really do live in a time, in an era where there are so many opportunities for people in all different fields with all different skills that are related to the kind of jobs and the kind of passions that they might originally have that may not be the exact same job, but can be done from home, can be done with accommodations, and can give you just as much, or at least very close to as much, fulfillment as you might have originally had. But even if it doesn't bring you the exact same, even if it's not the exact perfect job that you always dreamed of having, the difference is that hopefully this job with the right accommodations in a field that you're passionate about will do something to increase your quality of life instead of decrease it. And I want to discuss this quality of life because it's a big issue when you're talking about your career. For a lot of people, they go into situations where they feel like, this is the job that I want to have. This is all that's going to make me happy. This is the only job that will make me happy. And they go into it and it's the most strenuous, stressful job, not because the job is stressful, not because that they're not equipped to the task of the skill level of the job, but because their illness is so consuming and so threatening that ultimately it decreases their quality of life and it decreases their ability to withstand the pressure and the stress of the job, and it makes it less enjoyable over time. So what you're looking for is not just a job that makes you happy, but also a job that over time is going to continue to increase your quality of life instead of decrease it. And that's a real conversation that you have to sit down and have with yourself. And when you're looking at jobs, when you're looking at job descriptions, really have that conversation honestly with yourself, because choosing the right job is the first step in having a great career. So chronic illness and employers. We'll talk a little bit now about working in an office atmosphere, working for companies. This is for people who are going kind of a more traditional route. So one of the questions that I received in preparation for this webinar was, when do I announce a disability? So many people come to me and they're like, when or should you tell your employer or potential employer about your health problems? When do you say, by the way, I have a serious chronic illness? Do you do it during an interview? Someone said, I feel like I'll never get hired if I tell them I can only work part-time because of my health problems. Okay. So let's talk about making that big announcement. When is it the right time to reveal that you have a chronic illness? So I did a lot of research on this as well when I was writing the book. I spoke with some lawyers, and I'm not a lawyer myself, but the answer that I got was that legally speaking, in a job interview, there is no wrong time to tell an employer that you have a chronic illness. You can't be excluded from a job interview because you have a chronic illness. You can't be fired from a job because you have a chronic illness. There are ADA disability rights that you have to protect you in the case of having a chronic illness. That being said, let's say you do go to a job interview and you're up against 10 other candidates and you're just as good as candidate A and B, but you also mention that you have a chronic illness. Well, sure, legally, that recruiter can't say, I'm excluding her because she has a chronic illness. However, he can say to himself, that sounds like it'll be too complicated for me. Candidates A and B don't have a chronic illness. Candidate C has red hair, and you know what, I just don't think I can work with someone with red hair. Yes, that can happen. So I think that the interview may not be the best time to announce that you have a chronic illness. And so a lot of the concern that I got when telling people that advice was, but I don't want to lie. Well, you're not lying. Legally, you have a right not to disclose, and that's the word we're using here, disclose your chronic illness. Not actually to your employer. You don't even have to disclose it directly to them, and you certainly don't have to disclose it during a job interview. That is perfectly within your rights. It is perfectly moral. So post-interview, is that when you do it? Let's say the interview went really well and you think, I'm going to get this job. You haven't heard back from them yet, but you're thinking, well, the interview went well, so maybe I should just send them an email or do a follow-up phone call. And by the way, I have a chronic severe disease. Still not the right time. What about after a job offer? Getting closer, definitely getting closer. You really want to wait until the value of yourself as a professional has been fully evaluated and accepted. And then somewhere between the signing of the contract and the first day on the job, or at least very close to the first couple days on the job, you do want to disclose your disease. And again, this is all your choice, but in my opinion, from what I've researched, from the people that I've spoken with, from the professionals and the employers that I've spoken with, the best time to do this is certainly at least during the first week of work. And the person that you go to, it isn't your boss, it isn't your coworker, it isn't the secretary, it's your HR person. Especially if you work in a larger company, go to your HR person. They are your advocate. You want to go to them, let them know in all honesty what's happening, and tell them your story. You should feel free to disclose as much or as little as you want, but the more that you disclose to your HR person, and of course you have confidentiality with them, they will be able to help you the most abundantly with accommodations. The times that you do not want to disclose your disease are later, when you're hospitalized and you have no backup plans and everyone is counting on you and they had no idea. that's not a great time. Also, when you're dying on the conference room floor, not a great time. Definitely want to try and do it before that. So there's a lot that goes into the thought of making that announcement. I discuss it in a lot greater detail in the book, but those are the bullet points, and I hope that helps with some of the confusion. So what does honesty achieve when you're in an office environment, when you're working with clients? How does that really help you? I mean, like I said, you don't want the stigma attached to you. You don't want people gossiping about you. There are so many downsides to revealing that you have a chronic disease. It's so private. Why would you even want to do it? So the knowledge of your situation gives you access to accommodations. That's number one. Your company is not legally required to accommodate you if they are not aware of your disease. They can't possibly do that. So in order to help you, in order to make your work experience as functional as possible, they need to know about what's going on with you. Knowledge of your situation helps set expectations for time restraints and obstacles. So when you go and you tell your HR person, who will then help you have that conversation as needed with your other employees, coworkers, bosses, managers on a need-to-know basis, they will help have that discussion about, what your time limitations are if you can't work at certain times. They'll explain what kind of accommodations you need, and they don't have to give all the gritty details. They can be your advocate on your side and say, that's all you need to know. Legally, that's all you need to know. And knowledge of your situation, it kind of forces coworkers and clients to be a little more open-minded to new ways of working. So I'm going to talk about this a little bit more, but there are so many tools and so many accommodations that are available to people with disabilities and chronic illnesses. And honestly, having your team even know a few small details, an overall idea of what's going on with you, can help them be a little bit more accepting of using these accommodations in the future, of being sensitive to your needs. And it kind of just helps the whole workflow work better. So your questions. Let's move on to the next one. Accommodations. So like we said, brain fog is a big problem at work. Someone mentioned, my memory is awful and it interferes with all aspects of my life. Not being able to remember a client's name or question when put on the spot or asked by an employer. I do write most everything down, but I randomly will be asked a simple question like, did you schedule this client, Kathy? And I won't be able to remember, and I feel stupid and the boss gets mad. Obviously a terrible, terrible situation to be in, and a super common one for so many people. There are a ton of accommodations out there. This is a really exciting thing because until I started researching this for the book, I had no idea that this was even a thing. I knew that there were rights that I had. I knew that I couldn't be fired because of my disease, but I didn't know that there were actually things that my company could do for me to make my job easier, when you think about it, your job wants to hire the best employees, and they want them to be as functional as humanly possible. They want them to do their job to the best of their ability. And the best way to do that is to accommodate them. So let's talk about some accommodations that you may not even know are available to you. So cognitive accommodations, these are for things, just like we mentioned, for brain fog, for things like chronic fatigue, for depression and anxiety. Provide written job instructions whenever possible. That's a big help. Prioritize job assignments and provide more structure. Allow flexible work hours and allow a self-paced workload. Allow rest periods. Provide memory aids, schedulers, organizers. These can really help with brain fog. And there are so many digital tools now that we'll also talk about that can truly help so much with brain fog. And I also have other tips for that as well. Minimize distractions in the office. Allow time off for treatment or for counseling. This can really help for people who have anxiety or depression. But also, if you have a chronic illness, I have to go to at least 3 doctor appointments a week. And no doctor is going to see me before 8 a.m. or after 6 o'clock. So they're going to happen in the middle of the workday. And my company has to understand that to accommodate me as an employee, I need to be able to go to those appointments. So that's part of my accommodations, and that can be part of yours. They can provide sensitivity training to coworkers if you feel that's necessary, if you feel that's something that you want or need, if you're having any kind of issues with gossip in the office, or if you have situations like you have a condition where people think, oh, she's lazy or she doesn't, work as hard as the rest of us. Sometimes sensitivity training is an amazing thing for an office. People need to understand what these diseases really mean, because there are so many stigmas and so many ideas of what a chronic illness is, and most of them are inaccurate. So we can develop strategies to deal with work problems before they arise. This is a huge thing, and it goes hand in hand with why honesty is sometimes a better policy than most when it comes to being settled into a job and telling your team, or at least telling your HR department, because you can start to develop contingency plans. I'll give you an example. When I signed on to my job that I currently have, I talked to my HR person, and I think the first month that I was there, I had 3 or 4 emergency room hospitalizations, and I missed some morning meetings, and I texted my HR person and I said, in the emergency room, we'll be there later. And she was like, oh my goodness, are you okay? Are you fine? What's going on? And I was like, no, this is chill. This happens like all the time. Don't worry about it. And we actually had to work out a kind of like a threat level, an emergency level of what to me was an emergency and what was just having a chronic illness. So me being in the emergency room, I would say to her, this is like a level 1 emergency room visit where, hold my calls, but I'll be back later today. Or this is a level 2, hold my calls, but I'll be working from home later and I'll answer emails. Or level 3, I'm going to be out for the day, let people know. Or level 4, I might be here a while. I'm probably going to be operated on. I don't know what's going to happen. Don't save me any cake. Okay, so allow telephone calls during work hours to doctors or other support. Of course, just like going to doctor's appointments during the day, I have to take doctor's calls during the day. And people who have any kind of anxiety issues, it's great for them to know that they can stop and call their doctors or other support systems if they need it throughout the day, if they're having problems at work. It's going to make them more functional at the end of the day, so that's what they need to do. And then, of course, your HR department should also be able to provide information on counseling or any other employee assistance programs, which some companies have great ones. So don't be afraid to ask for those kind of resources, because they're there and they're there for a reason. Physical accommodations. So let's say you work in an office and you are just severely ill with physical issues that affect every moment of your entire life. So there's a lot of things that your office can do for you, that your company can do for you. So let's talk about them. They can reduce or eliminate physical exertion and workplace stress. And this goes, sorry, I'm gonna sneeze. No, I'm okay. So this goes hand in hand when we talk about choosing the right jobs. Obviously, if you have chronic pain issues, you probably shouldn't choose a job where you're lifting heavy things all day, where you're doing a lot of physical labor. But if there are small things, labor activities, let's say you're a teacher and you can't be moving desks around, you can't be moving furniture, you can't be lifting heavy textbooks, aids can be provided, different tools can be provided to help eliminate that kind of physical exertion for you. You can be allowed to work from home. So many jobs are doing this now. So many office jobs that were completely in a location are now all over the world. So this is not something you should be afraid to look into or ask for. You can implement an ergonomic workstation design. You can get different chairs, different yoga balls. There are different desks that you can have. There are standing desks. There are lower desks. Those can all help if you have any kind of back problems or physical pain. You can be asked to be allowed a flexible work schedule. This is also great if you work from home, because you're kind of at the office all the time. So a flexible work schedule is not too far off from what most people are doing right now. If you're in an office, you can be provided a scooter or other mobility devices. So when I talk about this, I'm not so sure how willing and certain companies would be to provide an actual scooter. But let's say you're working on a university campus or a large tech campus or something like that. You might actually be given a golf cart or some other kind of device to help you get around a large campus. So that's something you could ask for. If you have migraines, you can get better lighting and eliminate fluorescent lighting. And don't be afraid to ask for things like that. One, because a light bulb is worth an employee. You can ask for that. You're worth that. And also, if it's bothering you, it's probably really bothering other people too. Maybe not the level that it's bothering you where it's causing physical illness, but I don't think people are going to be so mad about you asking for better lighting to reduce headaches. You can also get computer monitor glare guards, again, for things like migraines. You can reduce noise with sound absorbent sound machines or headsets. You can be provided an alternative workspace. Some people that I've spoken with have had situations where they can't telecommute. They need to be in their office, but they still need to rest during the day. And so what has been done and been provided for them is that they have an office, usually a very small office if it's all that can be provided, and they have an air mattress in their office, or they have a couch in their office, and they're able to shut the blinds, close the door, take a nap, and that's what they need to do to get through the day. Don't be afraid to ask. Don't be afraid to do things that sound kind of weird or kind of unusual. You know what? If it gets you through the workday and it's the job you want to have, ask for it. Go for it. Do it. You can ask for a fragrance-free workplace policy. Many doctors' offices you'll see now have signs that say, don't come in here wearing perfume. We have sensitive people. If you work in a small office, if you're close to other people, that's not a terribly strange thing to ask for, whether or not you have a chronic illness. And then modify dress code for temperature sensitivities. Too hot, too cold. If you're wearing a uniform, sometimes those things can just be adjusted for you and are not as big a deal as you might think they are. Okay. So beyond working from an office, let's talk about working from home. So I've been working from home for several years now, and I love it. I think it's a great thing to do. If at all possible, I always encourage patients with chronic illness to work from home because it extremely, extremely reduces stress, improves quality of life, and allows you to focus on your job and not your body, which is something that we all really want to do when it comes to our careers. And it's just another thing that helps us get through. It's a great tool, and it's become so just prolific in our society that so many people are doing it, so many tools. So during this part of the webinar, we're going to talk about things, tips and advice for things like video meetings, different organizational programs you can use, team communication tools. I'm getting really excited about this because this is actually something I really enjoy talking about, your schedule and your symptom pattern. And while I'm talking about this, I also wanted to shout out to my friend and colleague, Joan Friedlander. She wrote this book, Business from Bed. Such a great book. You can go on Amazon and get it. It has the 6-step comeback plan to get yourself working again after a health crisis. She is a business coach for people with chronic illness. She's helped so many people, and we work together at Global Genes. So I just had to mention her in this webinar. So if you're looking for some more reading materials beyond my book, you could order both books, Surviving and Thriving with a Chronic Illness and Business from Bed, and like you're set. Okay, so tools to work from home. There are so many great apps, softwares, programs, and tools out there for people who are starting to telecommute. Now, I work for a company right now that has people from all over the world. And I was just talking to some of the other girls on the WEGOHEALTH team before the webinar started, and we all work from home and use a lot of these tools, and they're great because you can have these big teams all over the place and work just like you're sitting right next to each other all day. So I'll walk you through some of these. There are so many more out there, so many to explore, but these are some of the basics. So I'll see if I can annotate a little bit. All right, so Skype. Skype is like your super basic program. Everybody's heard of it, video messaging. It's a little outdated actually now, but people still use it. The updated version is Zoom. Sorry, my annotating here is not amazing. That just gives you an idea of what my handwriting looks like. Anyway, Zoom is a great tool. We're using it right now. This is a webinar platform, but it's also something that companies use and consultants can use to do video conferencing with people. It's great because it has a chat function, but the really cool thing is that it allows you to talk with multiple people on video at once, which Skype does not allow you to do, or at least not on its free program. Zoom is also paid, but it's a great tool. I've been on Zoom calls that had, I think, up to like 20 people on them at once. We actually had a Halloween party in my office that was completely virtual, and we all did costumes, and we were all on camera, and it was great. It was a lot of fun. So Zoom is a great tool for that. And then we just updated to Slack. Wow, that's bad. Sorry. Okay, so Slack is a great tool. I really like it because, like I said, I have problems with brain fog, and unlike Zoom, Slack actually saves all of your conversations that you have both, well, you can type in messages with your coworkers, either one-on-one or in different channels, and it saves all of that information. You can upload all of these files. It saves everything, and you can also video chat and voice chat through it. So it's just like this one room tool that really saves everything. And I need to have reminders of what my last conversation was. There are so many people in my company. I need to know where I left off with everyone. And so that's really a great tool for me and for my whole company to use. Now, a long time ago, we used to just use Google Documents. And I still use Google Documents for some things, especially when I work as a consultant with clients who don't work with a lot of these programs, who aren't as tech savvy. Google Documents are great. Simple things like using just a Word document that's collaborative so that you can both write on it at the same time. I actually just did a podcast, and we were all doing the podcast over the phone, but we were on a Google document at the same time, editing parts of the conversation, taking notes together, and it was all saved, and you can insert pictures and everything like that. So that's really cool. You can also share spreadsheets. You can upload documents to it. You can do the same thing as far as uploading documents and sending large files through programs like Dropbox, which are great. And there's also programs like Confluence, which is just like an online huge database of ways that you can store information and have a collaborative effort with a huge team. So that's great. And then there are other little programs here that I wanted to point out. Venmo, Expensify. Venmo, if you're a consultant and you don't always have the energy to go to the bank, or you don't have an accounting department, or you're a one person production, Venmo is a great way to help you get money from your clients. They can just send it right to your bank account. You don't have to go to the bank, which for me is great. Anytime I don't have to leave my house to do a task, that helps. Okay, so now how do I get out of annotate? Okay. Oh no, now I, sorry, now I have clear all my drawings. There we go. Okay, don't worry guys, I figured it out. All right, so I wanted to talk to you about your work from home space. And so we were just talking about this too I was talking about this too with the rest of the WEGO team, how we set up our home offices. So as you can see here, I have my little home office area. And this is the cleanest part of my house. Nothing else looks like this. And that's saying something because I don't think it's really that pretty to begin with, but this is my setup. But this is my setup when I'm feeling okay. There are days that I'm so sick that I cannot get out of bed or the bathroom, as we discussed. So I have a couple of tips on making your home webinar space as professional as possible when it is as unprofessional as it could possibly be. So I'm going to show you some of my favorite things to have in my home office. So the first thing here is this little rolling desk. I'm not going to do the annotate again. It's just my handwriting's too bad, guys. So this little rolling desk in the corner here, I love this. There are 1,000 like it. I'm sure you can get it at Walmart or something, but I got mine on Amazon. It was $20. Love a bargain. And it's just a rolling desk that I love because I can roll it from my office into the bathroom and next to my bed, wherever I decide to collapse when I'm feeling awful. It's my kind of rolling office. And so I use that all the time. It works so great for me. It's such a great thing to have. So I can just keep going wherever I end up needing to be. And frankly, if you have IBS, if you have Crohn's, if you have any kind of disease like that, and you have days where you're like bolting to the bathroom, that's what you want to have. So you can just keep working. So that's my tip for you if you're someone with an IBS chronic illness and you're worried about how you're going to manage a day when it is that bad. That's what you use. Okay, and then the second thing I recommend, of course, is that you have a laptop and not a desktop. If you're a graphic designer or a video editor, it's great to have some kind of large screen, but for most purposes, for people with chronic illness, you want to have a laptop, not just for the rolling desk situation, but also for when you need to leave your home office to go to exciting places like the hospital or the doctor's office waiting room, and that's where you need to work for the day. So I have laptops, that's what I use. They're the most functional for me, so that's what I would recommend. The two other things that I have right here is a whiteboard. I have a big one in my office, and I also have, of course, a small portable one because who knows where I'll be, hospital, doctor's office, bathroom. So I always want to have some kind of whiteboard with me, and I write on it my main project deadlines for the week and any meetings that I have, and it's just good to have it in front of me to make sure that I'm on task. So I think those are great to have. And then the other thing is a backdrop. So let's say you do have to have a video meeting from bed, and you you obviously don't want to look like you're in bed. So you can actually buy these on Amazon, or I'm not really sure where else you would buy them. Probably from like a photography place, but that's really the cheapest place you can get them. A lot of people use them when they're video bloggers and they want to be professional, but you can actually get pretty cheap sets like this, or you could do something where you just hang a curtain behind your bed, something that makes it look neutral. You don't always have to have a professional backdrop behind you, so that can be helpful. So those are my tips for just your general home office, making it work when nothing is working. This slide I was excited to share with you because it was something I talked about on my Instagram the other day where I was concerned because I did have a situation where I literally just rolled out of bed and into a meeting, and I was like, oh my goodness, I hope I don't look like I just rolled out of bed and into this meeting. And I didn't, and people assured me. And so that was good. So this is what I use to make sure that I don't look like I'm a ragamuffin that just rolled out of bed, even though most of the time that is what I'm doing. I always keep a couple of blazers or nice jackets by my desk so that if I happen to be in my pajamas or just am wearing a gross shirt or look gross in general or don't look professional, I can throw on a blazer and all of a sudden instant professional. I also like to wear earrings because they make you look a lot more dressed up than you really are. You don't know it, but I'm wearing pajama pants right now, but I'm wearing earrings, so it really looks like I might have even gone outside today. I didn't. And then I always keep a small makeup kit by my desk and a hairbrush. Those just help you look, again, like you didn't just roll out of bed. And then again, that helpful backdrop can really be a great thing. Just make it look like you're not actually in bed if you actually are still in bed. Okay, so fatigue while working from home. This is a big one. Fatigue, we talked a little bit about what to do when you're in an office atmosphere and you're dealing with it, but you still deal with chronic fatigue when you're working from home. So some of my quick tips here, because I know we're getting through this. I always try to manage my schedule as best I can as related to my symptoms. So in some situations, I have really bad chronic pain, and chronic pain is it's kind of easier to deal with in the morning because I haven't been dealing with it for 10 hours. So I do all of my cognitive tasks, things that like writing emails, writing important letters, writing important content, anything, reviewing things, anything like that. I do it as early in the day as possible. And then I do my menial tasks towards the end of the day. And sometimes if I'm going through a bad flare and I know it's bad and I know that I'm either going to have to take pain medication or I'm just going to get fuzzier throughout the day, I sometimes even wake up super early, like 5 a.m. and work from like 5 to 7 on those really important tasks so that I can just go straight into the fetal position by 9 a.m. because sometimes that's just what you got to do. So some other things you can do to deal with fatigue, take cold showers in the morning, be in a cold environment. After all, you're going to be wearing those, I'm a professional blazers, so you don't want to fall asleep because you're super warm. And then if you can, if at all possible, if you're having days where you're just in bed all day and you have a video meeting, try to move out of bed if you can. Even sometimes I moved out of bed and literally just like positioned myself against a wall a foot away. Sometimes it just helps you to stay a little bit more awake if you're not in that actual bed. So if you're dealing with chronic fatigue, try to just change positions a couple of times a day. I know that sounds kind of obvious, like don't fall asleep because you'll be in bed, but good to know. Schedule breaks. So I use a Google Calendar and I have out of office blocks and I just drag and drop them throughout the day whenever I need breaks. And I don't always know when my breaks are going to be, but because I have a calendar that's connected with all of my coworkers and clients, they can all see, don't contact me during this hour. I'm in a meeting and I will not be available. So I schedule breaks usually before and after important meetings so that I can fully collect myself and be entirely as present as possible. And I work when I am most functional. Again, that's just scheduling yourself around your symptoms. So 2 other tips that I would have are take notes. As always, I have probably like 100 of these notebooks all around me. I do phone calls all day and I just can't keep track of conversations. So I write everything down. And then at the end of the day, I collect all those notes because of course, like you have seen, my handwriting is a disaster. So I take all my notes and at the end of the day, I put it into a nice little Word document. I print it out, put it in a folder, and that's my day. And I have it organized. And then the other thing I do, if I really need to, if I'm having a really bad day and I'm having a really important conversation, I record phone calls on my phone or on my computer, and I'm able to listen back and take notes when I'm a little more functional later on. So those are all things that I would recommend if you have chronic fatigue. And I'm going to go over these a little quickly, but insurance and disability, again, not a lawyer and not a social security expert, but these are things that I did research while doing the book. So the insurance issue, a lot of us are consultants, a lot of us are right at the moment unemployed, or maybe you're just onboarding onto a job, but you're trying to figure out your insurance options, and I'm just going to spell out the realities for you, and you probably know them, but maybe you need to hear them again. So the insurance issue, you have a couple of choices. If you're under the age of 26, you can use your parents' insurance, and you stay on that insurance as long as you possibly can. You can use a spouse or a long-term partner's insurance. My husband, I actually went on his health insurance a year before we actually got married. His company allowed it, and I was able to bridge the gap. You can purchase your own insurance, or you can get on Medicaid and be on disability. But the reality check is you can't really live with a chronic illness and not have insurance. So you need to prepare to make it a priority. And it's going to mean cutting corners in places. It's going to mean, doing the best you can with what you have, but it's not something that you can truly live without and continue to function and thrive without. You have to take care of your disease first. So your questions, working while on disability. Can I still work while on disability? What if I end up being too sick to handle it? And then had to use this image. I have made a huge mistake because certainly I hear this from people all the time. I'm too scared. I don't want to get off disability, because what if I can't handle the job? What if I get too sick? What if something happens? Because something always happens. What if I have a flare? I always have flares. You can't tell and you don't know. Chronic illnesses are, just as a general rule, pretty unpredictable. So here's something you might want to know. And obviously there's a ton of information out there on SSI and working, and it's very complex and there's a lot to know, but I thought this was really important and really interesting and just a good brief thing to know. But when on SSI, you cannot be doing what is called SGA, or substantial gainful activity. AKA, you can't be working and making more than $1,180 per month in the year of 2018. That's the updated rule, or $1,970 if you're blind. So for SSDI recipients, there is a trial work period during which you can make more than the SGA amount without losing your benefits. That's pretty cool. SSDI recipients are entitled to test their ability to work and continue to receive full benefits regardless of whether they make more than the SGA amount for a 9-month trial work period. So SSA considers any month where a person has a monthly income of more than $850 a trial work month. So once you have completed the 9-month trial work period for a period of 36 months, you can still receive SSDI for any month where your earnings fall below the SGA level. So this is pretty cool. Like, some people don't know that they actually have this pillow, the security that they can test this out. You can actually go out there and see if you can handle having a job. You do have the security to do that. So just something that's out there that you should probably know about. I thought it was worth bringing up in this interview. Again, not a lawyer and not a disability SSI expert, but definitely worth thinking about if you're thinking about maybe getting back into employment. And then I wanted to leave you with some, resources. This is the book's website, chronicillnesssurvivor.com, which will tell you a little bit more about the book. And the book is full of resources, has plenty of information on working with a chronic illness and dealing with all of the awkward social issues involved with chronic illness. And then SSA.gov, EEOC.gov, AskJan.org. These are all government job sites that will help you get a little more information and perspective on the legalities about working and disability. The book Business from Bed by Joan Friedlander. Gotta get yourself a copy of that. And then my website, chronicallyemployed.com, which I am always looking to showcase different consultants and employees who have chronic illnesses, who want to share their story about how they've made it work with a chronic disease, whether that was through accommodations, working from home, or other unique ways that they've found ways to manage having a career. So that wraps up pretty much what I have to share for you. Again, this is the book. These are some ways that you can connect with me. I hope that you will. Please add me on Instagram. Let's share each other's stories. I want to learn about you. You can follow me on Twitter and email me. So thank you so much.
Thank you. What a great webinar. So I've been chronically ill for 11 years, and I've also been working from home for almost like 3.5. And there were definitely things in there that I hadn't thought about or, could reconsider. And I'm sitting in my office right now thinking about how I could rearrange it based on some of the things that you talked about. So there's some really good tips in there. We do have a question for you. And the question is, do you have any recommendations for background noise during meetings, like dogs or something outside your house?
Oh, sure. One, you could definitely kick them out of the room. Second, honesty is always a good policy. I live in an apartment complex where, for whatever reason, anytime that I have an important meeting, the gardeners show up. They're always right outside the window when that happens. And I just try to be honest with my whoever I'm talking to that's what's going on. But if it gets really bad, that rolling desk is my best option, because I kind of just leave the room and go into another area where I can get away and into the quiet. You can also use a headset. Those sometimes help mute the noise.
It's a really good suggestion. Sometimes we have to use headsets based on whatever's happening around. And sometimes it's always the really unpredictable things that come up. So I always feel like I have a headset in my car, in my bag for my laptop, in my office, like just in case everywhere. I think that's all the questions that we have for right now. So I just wanted to remind everybody that don't forget, next week on Wednesday, we're going to put a recap of this webinar on our blog. So if you want to review any of the topics we talked about, or maybe you wanted to look over some of the information and take more notes or share them with somebody, that'll be up there for you on Wednesday. And also as a reminder, Ilana's book, Surviving and Thriving with an Invisible Chronic Illness, is available in stores on March 1st and is online now. So thank you, Ilana, for hosting with us. This was a really, really great webinar, and I hope that everybody learned a lot. And have a great night, everyone.
Thank you.